Hello everyone. Today we are going to see about infection control and hand hygiene. I am Sharon Evangeline, working as a tutor in Tribulum College of Nursing. In this session, the viewers will be able to know about the introduction, types of infection, common pathogen and some infection they produce, control and prevention to reduce reservoir of infection, and finally we'll end with hand hygiene and we'll conclude with conclusion. So we'll begin with introduction. We all know what is infection and how it should be controlled. So we'll see what is infection control. Infection control means all the steps that is taken to prevent the spread of infection from one person to the another. Especially in hospital, infection can easily spread between patients, nurses, doctors and visitors. As nurses, we are in close contact with patients, so infection control is very important part of nursing care. An infection can occur when harmful microorganisms like bacteria, fungus, virus and parasites that easily enter into the body and multiply and finally causing illness. These germs can spread through hand, that is infected, and air, blood and blood products, body fluids, unhygiene instruments or uncleaned instruments or contaminated surfaces. The main aim of infection control is to prevent patients from getting hospital acquired infection, protect healthcare workers from infection and prevent cross infection, that is spread of infection from one person to another. We'll move on to the definition. Measures practiced by healthcare person to prevent spread, transmission and acquisition of infection between clients, from healthcare providers to clients and from clients to healthcare providers. That is preventing the infection from patient to the healthcare workers and from the healthcare workers to the patient. We'll see in detail about the types of infection. There are 5 types of infection, that is bacterial infection, viral infection, sexually transmitted infection, parasitic infection and fungal infection. We'll see in detail about each one of the infections, how it causes, what are all the examples and how it can be treated. We'll see in detail. First we'll see about bacterial infection. Bacterial infection is caused by bacteria. Some of the common examples are tuberculosis, urinary tract infection, pneumonia and typhoid. It can be treated with antibiotics. Some of the signs and symptoms that patients may have is fever, pus, redness, swelling and pain. Then we'll move on to viral infection. Viral infection is caused by virus. Some of the common examples are common cold, influenza, COVID-19, we all know, and hepatitis B. It cannot be treated with antibiotics. In this case, antibiotics do not work. Mostly it can be treated with rest, fluids and antivirals if it is available. And then we'll see about fungal infection. Fungal infection is caused by fungi. Some of the common examples are ringworm, athlete's foot, candidiasis, oral thrush, vaginal yeast infection. It is common in moist areas of our body. It can be treated with antifungal drugs. Then we'll see about parasitic infection. Parasitic infection is caused by parasites, that is worms or protozoa. Some of the common examples are malaria, amoebiasis. It can be spread through contaminated food, water, or through mosquitoes. It can be treated with antiparasitic drugs. Last, we'll see about sexually transmitted infection. It is some of the common sexually transmitted infections are HIV, AIDS, syphilis, and gonorrhea. These are all the types of infection. I hope everybody would have known about the types of infection. Then we'll see about common pathogens and some infections they produce. Virus, the pathogen virus, the disease that causes in human, animals including human and plants, that is HIV and AIDS in humans, influenza in animals, and tobacco mosaic infection in plants. The pathogen bacteria causes disease in humans or bacterial meningitis and cholera. In animals and also in humans is tuberculosis, and plants ring rot infection. The pathogen protozoitic called eukaryotic organism that causes disease, malaria in animals and humans. Lead blight disease in plants, especially in potatoes or tomatoes. Fungi, the pathogen, causes disease, athlete's foot, ringworm, black sigatoka, that is in plants. Now we saw about the pathogen, disease, and host. Then we'll move on to the control and prevention to reduce the reservoir of infection. We all know the control measures, that is hand hygiene is one of the important and we use in our daily life. It is one of the basic thing to control and prevent to reduce the reservoir of infection. And so some includes like bathing, dressing changes, contaminated articles. We will see about the hand hygiene. Use appropriate alcoholic antiseptic or soap, or we should wash our hands with lukewarm water. Bathing, using soap and water that cleanse our skin from dirt, secretions, and some of the infections. If the dressing is spoiled or wet, we should change the dressing to prevent infection. Contaminated articles like the tissues or solid dressing or solid linens should be properly disposed, and it can be one of the control measures to prevent the infection. And contaminated needles should be properly discarded in a needle bin, that is white. Bedside units should be kept clean and dry. Bottle irrigation solutions, that is it should be always capped and it should be dated with open date and the date of expiry. Surgical wounds should always be closed to prevent the infection. Drainage bottles and bags should always be emptied and it should be marked. The intake and output should be marked properly. And at last we have come to the end, that is preventive measures, the main part, that is hand hygiene. We have 7 steps to hand hygiene. That is, first step is hand to hand. We should rub our palms, both the palms together. And second step is rub the back of both the hands. The third step will be one palm, right palm over the left palm and left palm over the right palm and interlace the fingers. Fourth step will be back of the fingers to opposite palm with fingers interlocked. Fifth step will be our thumb rotating of thumb rotation, both the ends. And sixth step will be nail butts, rotational rubbing backward and forward with clasped fingers of left hand and right hand over the left hand. And the seventh will be wrap left hand over right wrist using rotational movements up to mind forearm and vice versa. These are all the 7 steps of hand hygiene. These are all the preventive measures of hand hygiene. If we follow the hand hygiene steps regularly, we can able to prevent the spread of infection and transmission of infection, and we can control the infections that is spread from the nurses to the patients or the healthcare workers to the patient. We should wash our hands using antiseptic hand wash, or we can also use the antiseptic hand rub. We can also have surgical hand wash techniques. And washing refers to washing hands with plain soap or water or in lukewarm water. It should be sterile techniques. And finally, we'll conclude with the conclusion, that is, infection control is a critical component of patient safety and public health, and health hygiene is its most effective and simplest measure. Proper hand hygiene significantly reduces the transmission of pathogen, prevents healthcare associated infection, and protects patients, healthcare workers, and the community areas. Consistent adherence to standard precaution, especially regular and correct hand washing or using the alcohol-based hand rubs, breaks the chain of infection. It can reduce morbidity and mortality and ensure a safe healthcare environment. So, from the beginning, we have seen about interaction, types of infection, common pathogens, and the preventive measures and hand hygiene, and we have concluded. I hope everybody would have known what is infection control and how it can be prevented using hand hygiene. Thank you.